you for joining me for the Employee Benefits Open Enrollment Meeting for Mora Consultants, LLC. The agenda for today: what is being offered on June 1st, 2026? What is open enrollment? What actions can you take? How much do the benefits cost? What are the benefits and how do the plans work? How do I find a provider? What do I need to do now? And then just a reminder, we have switched over to the EASE enrollment platform this year. We are here to help. You have access to your Mora Consultants Human Resources team by emailing them at humanresources@morallc.com. My name is Kara Voelker-Hatch. That is my direct line at 619-668-5203, and my email at kara@tgfs.com. And you also have access to my benefits service team. You can reach them directly at 619-668-5202 or email them at servicepro@tgfs.com. All of us are here to answer questions about the benefits, how to find providers, what your next steps are, and how to use the EASE enrollment system. What's happening on June 1st? All employees will make their benefit elections on the EASE online benefits portal. Mora Consultants is no longer using iSolved for benefit elections. You will receive an email from EASE announcing open enrollment and giving you access to the system to make your open enrollment benefit elections. All eligible employees must log into EASE to either enroll or decline coverage. As we have moved enrollment systems, you must log in and tell us what you do and do not want. Nothing has rolled over from iSolved, so we need you to put benefit elections into EASE. This is the EASE online enrollment portal. When you receive the email, you'll click a link. It'll bring you here, and then it will have you set up your password. Please note that there are 3 languages available to you. So if you wish to prefer to use a different language, you can choose one of the 3 below the login button. That'll switch it to that language and you can move forward in that language. If you have any problems with your password or getting logged in, feel free to email my Service Pro team at servicepro@tgfs.com, and we can help you reset your password, get you into the system if there's any problems. You are welcome to click the forgot link, but it's faster if you just go directly to my team. What's happening on June 1st? So we do have some changes regarding the medical program. First and foremost, we are adding Sharp Health Plan as an additional medical carrier for San Diego employees, and there will be 3 plans available to you: a Platinum HMO, a Gold HMO, and a Silver HMO. You can also renew with Anthem Blue Cross, and we're going to offer 4 plans: Platinum HMO, Gold HMO, Silver HMO, and Silver PPO. We will no longer be offering the Gold PPO. If you're currently on the Gold PPO, you've been deferred to the Silver PPO. And if you want to make a change, you'll need to pick a new plan in the EASE system. The dental, vision, and voluntary life will renew with Humana with no changes. So what is open enrollment? May is your open enrollment month. This is the time for each eligible employee to learn about plans and rates. You can make changes, you can enroll, you can waive, you can add or remove dependents like spouse or children. You can switch between plans, like go from Anthem to Sharp. Any change you make in the EASE system or election will go into effect on June 1st, 2026. The deadline to make changes and complete open enrollment will be Monday, May 11th. You must log into EASE to review plans, rates, and finalize your elections for the new year. In order to make changes after June 1st, 2026, you need to have a qualifying life event. Some examples of these would be getting married, having a baby, adopting a baby, getting divorced, losing or gaining other coverage, losing or gaining Medicare or Medi-Cal, or turning 26 and aging out of your parents' plan. If you do have a major life event that could affect your benefits, please reach out to the Mora HR team and let them know. Please be aware you only have 30 days to make a change when a qualifying event occurs. So as soon as you know something's happening, please reach out to your HR team. Cost of benefits. Everybody's cost is going to be different because it is based on age for medical and the plan you select and the number of dependents you enroll. So to review costs, please log on to the online enrollment system EASE for more information. Once you enter the information for yourself and your dependents, you can toggle through EASE and look at different plans and different costs and find the one that best fits your needs. Health and welfare fringe benefits explained. Under the Service Contract Act, each employee receives additional money beyond their salary to utilize towards healthcare benefits such as medical, dental, vision. As a government contractor working under EO 13706 contracts, employees accrue hourly fringe benefits to support health and welfare coverage. These rates are established by contract guidelines and are subject to change with each contract option year. Employee fringe benefits will first be utilized towards open enrollment elections and healthcare costs. Remaining dollars will be utilized towards the 401k plan. The 401k plan is offered through pcsretirement.com. You can sign up via pcsretirement.com link and then select investment funds, deferral deduction amounts, or percentage of salary you wish to put away. Employees can change investments and deduction amounts throughout the enrollment year. The max 2026 pre-tax dollar deductions towards 401k plans, if you are under the age of 50, the maximum contribution is $24,500. If you are 50 or over, you do have an additional catch-up contribution of $8,000. Service Contract Act employees can use the health and welfare allowance to purchase the above benefits. For California SCA employees, the balance after purchasing the benefits will be deposited into their 401k account. Further, all insurance benefits are subject to change at any time at Mora's discretion. For more information regarding fringe benefits in the 401k program, please reach out to Mora's HR team at humanresources@morallc.com. We will next be going over the benefits offered to you, giving you examples of each plan and the 10 or 12 most commonly used benefits available to you. Please see the summary of benefits and coverage for each plan for more details and additional benefit information. The benefits shown here are not every benefit available to you. The first program we're going to look at is Sharps HMO. And again, you must be a San Diego or Temecula employee to use this program. The way it works is that we have a platinum HMO to start. An HMO requires that you select a primary care physician, and that would assign you to a particular medical group. And I will go over which medical groups are included in the Sharp plan. You are welcome to change your primary care physician at any time by calling the member services number on your Sharp card and requesting a change to a new primary that would go into effect the first of the month following. You and your family members, if you enroll more, additional family members, do not have to have the same primary care doctor or medical group. If you elect the Platinum HMO, the first thing you're going to note is there is no deductible. A deductible is a first dollar amount of money that you would owe upfront for any services that say after deductible. The out-of-pocket maximum on this plan is $4,500 for an individual, $9,000 for a family. The out-of-pocket maximum is the most amount of money you will spend out of your own pocket in a calendar year from January 1st to December 31st. Regardless of our renewal date, deductibles and out-of-pocket maximums are based on the calendar year. Everything goes towards the out-of-pocket max. Copays, coinsurance, deductibles, prescription drug copays. Once you've spent $4,500 on an individual in the calendar year, you are done paying copays or coinsurance for that person for the rest of the calendar year for covered services. If you need to seek care with a doctor and you see a primary care doctor on this plan, it's a $20 copay. If they refer you to a specialist within your medical group, you will pay a $30 copay to see that specialist. If the doctor needs you to get lab work done, it is a $20 copay. And if they need you to have x-rays done, it is a $30 copay. If you have advanced radiology, MRI, CT, PET, CAT scan, that is a $100 copay per scan. If you are admitted directly into the hospital, you will pay a $250 per day copay for the first 5 days you're in the hospital. If you are still in the hospital on day 6, you no longer owe a copay and the plan comes in at 100%. Please note that is per admit. So if you are discharged from the hospital and then later in the calendar year readmitted, the $250 per day copay restarts up to the next 5 days in that admittance. If you need outpatient surgery, it's $100 copay. If you go to the urgent care tied to your medical group, this is very important on HMOs. You cannot go to just any urgent care. Each medical group has their own urgent cares, and you can look that up by going to the Sharp website, pulling up the network, and pulling up the urgent care tied to your medical group. It is important that you know that if you go to the wrong urgent care, you are a cash payer. So for example, Sharp Community uses different urgent cares than Sharp Steely, and same for Rady Children's. So please make sure you know which urgent care ties to your medical group. So if you have an urgent situation, you don't have to worry. You can just go to that urgent care. In this case, on the Platinum plan, you would pay a $20 copay. If you need to ride in an emergency transport like an ambulance, it's a $150 copay. If you need to go to the emergency room for a true life or limb-threatening situation, it is a $150 copay. If you need prescription drugs and you take a tier 1 drug, it is a $5 copay. Tier 2 drug is $20, and a tier 3 drug is $30 copay. This is for a 30-day supply. These are the benefits on the Sharp Platinum HMO. If you elect the Sharp Gold HMO, the benefits are slightly different and the plan price will be lower. This plan has a deductible of $250 for an individual, $500 for a family, and applies to services that say after deductible. The out-of-pocket max is $7,800 for an individual, $15,600 for a family. If you need to see the doctor on this plan, it's $35 for a primary, $55 for a specialist. Your lab work copay is $35. Your x-ray copay is $55. If you are referred to advanced radiology, you need an MRI or a CT scan, you will pay a $250 copay for that scan. And if you have not met your deductible for the year, you will then meet that, and that's $250. Please note deductibles are only met once a year. So if you get that MRI in July and pay $500 for it, and then 2 months later, the doctor needs another MRI, you don't have to meet the deductible again. You'll just pay your $250 copay and you'll keep on trucking. And again, all of that money is going towards your $7,800 out-of-pocket max. If you are admitted into the hospital on the Gold plan, it is a $600 per day copay for the first 5 days in the hospital. And please note, if you have not met your deductible, you will owe that $250 on top of the $600 per day. So if you're only in the hospital 2 days, it would be $600 per day for 2 days, which is $1,200. And if you have not met your deductible, you'll pay the extra $250, which takes you to $1,450. Similar to the Platinum plan, once you hit day 5, you are done paying your copay and the plan goes to 100% for that particular admittance into the hospital. If you are discharged and readmitted later, the $600 per day starts over. If you need outpatient surgery, it is a $300 copay after the deductible if it has not been met. Urgent care tied to your medical group is $35. Emergency transport is a $250 copay after the deductible if it has not been met. And the emergency room visit is also a $250 copay after the $250 deductible. If you need prescription drugs, it is $15 for tier 1 drugs, $40 for tier 2 drugs, and $70 for tier 3 drugs. These are the benefits for your Sharp Gold HMO. The next plan available to you is your Sharp Silver HMO. This particular program is, again, the same doctor network as the other 2 Sharp plans, but it is lower cost, but has higher copays, deductibles, and coinsurance. So you'll see here the deductible on this plan is $2,500 for an individual, $5,000 for a family, but this applies only to services that say after deductible. The out-of-pocket max on this plan is $8,750 for an individual, $17,500 for a family. If you need to see the primary care doctor, it is a $55 copay. If they refer you to a specialist within your medical group, it is a $90 copay. Lab work is $55 and x-rays are $90. If you need advanced radiology, MRI, CT, PET, CAT scan, it is a $300 copay after your $2,500 once per calendar year deductible. Inpatient hospital, outpatient surgery, emergency transport, and emergency room visits, you will pay 35% of the cost of this service after the $2,500 once per calendar year deductible until you've spent $8,750 out of your pocket. And then the plan will go to 100%. So if you had a $100,000 hospital stay, the most you're going to owe is $87.50, even though it says 35%, because you're going to hit out of pocket and be done for the year. Urgent care tied to your medical group is a $55 copay. And if you need prescription drugs on this plan, it is $19 for a tier 1 drug, $85 for a tier 2 drug, $110 for a tier 3, and there is a $300 brand deductible that applies to tier 2 and tier 3 drugs the first time you fill them in the calendar year. These are the benefits for the Sharp Silver HMO. So what doctors can you see on the Sharp plan? These are the medical groups that are included in the Performance HMO network. So there's quite a few programs, including Sharp Steely, Sharp Community, SCMG Palomar, Graybill North Coastal, Palomar Health Medical Group Temecula, Sharp Community Inland North, and Rady Children's/Children's Physicians Medical Group. You are able to go to sharphealthplan.com to look up providers. Please make sure you use the Performance Network. That is the network that's a part of this plan. Please note, if you switch from Anthem HMO to a Sharp Gold or Silver HMO, you are eligible for deductible credit because we are in the middle of the plan year. Employees and dependents will be credited for any amount to the deductible and prescription drug deductible, if applicable, that has been met on the Anthem Silver HMO, since that is the only Anthem plan we have that has a deductible. The out-of-pocket maximum is credited, but only for the deductible amount met so far. So if you have already hit out-of-pocket on the Anthem plan and you switch to the Sharp plan, you will not get full credit for your out-of-pocket max, only the amount of the deductible that's been met, which is why this only works if you're switching from the Anthem Silver plan to the Sharp Gold or Sharp Silver HMO. Sharp will ask for one deductible credit form per family member with a copy of the most current explanation of benefits submitted within 90 days of the coverage start date. To get a copy of the deductible credit form, please download it from the EASE website or contact our broker service team at servicepro@tgfs.com. The next program we're going to talk about is our Anthem program, which also offers 3 HMOs, just like it did last year. This would be utilizing the Anthem Select Network, and I'll go over which medical groups are in that program at the end of this presentation for the HMOs. The first HMO we have is the Platinum HMO with Anthem. Same thing, you must select a primary care doctor. That ties you to a medical group. You can change that once a month by calling Anthem customer service or member services on your card, requesting a new primary care doctor. On the Platinum HMO plan, there is no deductible. The out-of-pocket max is $2,100 for an individual, $4,200 for a family. A doctor visit to a primary care doctor is $20. If that doctor refers you to a specialist within your medical group, you'll pay a $40 copay. Lab and x-ray are both a $10 copay. Advanced radiology is $100 if it's done in the doctor office setting. It's a $250 copay if it's done at a hospital. If you need to go to the hospital and you are admitted, it is a $500 one-time copay for that admission. If you need outpatient surgery and it is done at an ASC or ambulatory surgical center, that's a $100 copay. If it's done in the hospital, it's a $150 copay. If you need to go to the urgent care, same rules apply. It must tie to the medical group you selected. So Anthem has the Sharp medical groups. They also have more medical groups. So let's say you're at Tri-City, you need to tie yourself to the right medical group and urgent care to make sure it's covered. That is a $20 copay. Emergency transport is a $150 copay, and an emergency room visit is $300. With Anthem, each tier has sub-tiers underneath it for prescription drugs. So in the case of tier 1, it's tier 1A or tier 1B. It's either $5 or $15. Tier 2A is $20, tier 2B is $30, and tier 3A is $50, and tier 3B is $60. These are for a 30-day supply. These are the benefits on the Anthem Platinum HMO. On the Anthem Gold HMO, again, you still have no deductible, but the out-of-pocket jumps to $7,500 for an individual, $15,000 for a family. A doctor visit is $30 for primary and a $60 copay to see the specialist. You need lab and x-ray done in the office. It's a $15 copay for lab or a $15 copay for the x-ray. Advanced radiology is $100 if done in a doctor's office setting, $250 if it's done at the hospital. Inpatient hospitalization is a $600 per day copay for the first 4 days you're in the hospital. Once you hit day 5, you stop paying. Now, again, this is per admit. So if you go to the hospital and then you are discharged and then you go back to the hospital at a later date in the calendar year, the $600 per day copay continues until you've met out-of-pocket max total. So you'll have 4 more days. And then if you're readmitted, again, the 4 days restarts until you've spent $7,500 out of pocket. If you need outpatient surgery at an ambulatory surgical center, it's a $300 copay. If you have it done at a hospital, it's a $450 copay. Urgent care tied to your medical group is $30. Emergency transport is $150. Emergency room for a life or limb-threatening situation is $325. And again, Anthem with their prescriptions, Tier 1A is 10, Tier 1B is 20, Tier 2A is 50, Tier 2B is 60, and Tier 3A is 90, and Tier 3B drugs are $100, again, for a 30-day supply. These are the benefits on your Anthem Select Gold HMO. The last plan we'll talk about is our Anthem Select HMO Silver. On this program, it's the same doctor network, but the difference is if you go silver, the deductible jumps to $2,500 for an individual, $5,000 for a family. The out-of-pocket max jumps from $10,000 to $10,150 for an individual, $20,300 for a family. Doctor visits are $60 for primary and $95 for specialists. Please note the deductible only applies to services that says after deductible, so your doctor visit does not subject to the deductible. Same with lab and x-ray. $20 lab, $20 x-ray, no deductible. Advanced radiology, if it's done in an office setting, it's a $200 copay. But if it is done in the hospital, it is a $350 copay after your $2,500 deductible. Inpatient hospital is a 45% coinsurance after the $2,500 deductible. But like I mentioned, once you hit your out-of-pocket max of $10,150, you are done paying copays, coinsurance, deductibles, prescription drug copays for the rest of the year. So if you go to the hospital and you have $100,000 bill, 45% of that would be $45,000. That is not what's going to happen to you. The most you'll spend is $10,150. That includes the $2,500 deductible. And then you are done for the calendar year. The insurance company picks up the rest of the cost. Outpatient surgery, if done in an ambulatory surgical center, is a $600 copay after the deductible. If it hasn't been met, remember, deductible once per calendar year. It is a 45% coinsurance after deductible if it's done in a hospital setting. Urgent care tied to your medical group is a $60 copay. Emergency transport is a 45% coinsurance after deductible if it's not been met. If you go to the emergency room, not only do you have to meet your $2,500 deductible if it has not been met, but there is also a point of occurrence deductible of an additional $500 plus the 45% of the cost of your services until you hit the $10,150. If you need prescription drugs, again, it is the 2-tier system. Tier 1A is $10, Tier 1B is $20, Tier 2A is $70, Tier 2B is $80, Tier 3A is $110, and Tier 3B is $120. Again, these are for 30-day supplies. And please note, if you're filling a prescription for Tier 2 or Tier 3 drugs, you will need to meet a $200 brand deductible once per calendar year. Please note, if you're currently on the Anthem HMO Silver and you continue on this plan and you've already met deductible, out-of-pocket max, blah, 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 that's going to roll on through because we're not changing the calendar year. We're just renewing. Same for that brand deductible. If you've already paid that and you're staying on Silver, you don't need to worry about it. You won't have to meet it again until January 1 of 2027. As you can see, the Anthem Select HMO doctor networks, there's a few more than the Sharp plans. Most notably, UC San Diego, UCSD Palomar Health, Perelman Clinic, One Medical, Perelman Clinic Direct, Prospect Medical Group, Rady Children's, Optum Care, Nuestra Familia, Greater Tri-Cities, Graybill, Blue Zone Health of California. So it has the Sharp and the Sharp Restidia and the Radies that's on the Sharp plan, but then it has UCSD and other medical groups. So if you aren't planning to use a Sharp doctor, this is the plan you want to go with to keep your current provider with UCSD or Perlman. The next plan we're going to talk about, and it's our last medical plan, is our Anthem PPO plan. Please note, I will only be going over in-network benefits. Please see the summary of benefits and coverage for out-of-network benefits, more plan details, and additional benefit information, okay? So this is in-network only. On a PPO, you can go anywhere you want, but there are both contracted providers in-network and non-contracted providers out-of-network. The most expensive way to get coverage is to go out of network. It will cost you a fortune. Doctors are welcome to balance bill above insurance contracted rates. Highly don't recommend, okay? If you're going to go PPO, the reasons you would go PPO is ultimate freedom. I want scripts, UCSD, Sharp. I want to go nationwide. I don't want to have to assign myself to a primary care doctor. I just want to go when I go. That would be the PPO plan, but it is your accountability to make sure every provider you see, from primary to specialist to lab to advanced radiology to hospital, is in network for the plan, or you'll be subject to the out-of-network benefits. On the Silver PPO plan, the deductible in this plan is $2,500 for an individual, $5,000 for a family. Out-of-pocket max is $8,700 for an individual, $17,400 for a family. If you go to the doctor and they're an in-network provider, it's $55 to see a primary. You do not need a referral to a specialist. You do not need to stay in the medical group. You just have to make sure they're contracted. So if you go to Scripps for your primary and you want to go to UCSD for your specialist, if both those doctors are contracted in network, you're good to go. You don't need a referral. You just make an appointment with that UCSD specialist and go in and see them and pay a $90 copay. If you need lab and x-ray in the office, it's $20 for lab and $20 for x-ray. Advanced radiology, MRI, CT, PET, CAT scan. That is a 45% coinsurance after the $2,500 deductible if it's done in office. And it's a $75 point of occurrence deductible plus the 45% after the $2,500 once per calendar year deductible if it's done in a hospital setting. So just be aware of that extra $75 if you do it in the hospital. If it is inpatient hospitalization, it's a straight 45% after deductible until you've spent $8,700 out of pocket for in-network providers, in-network services in an in-network hospital. Outpatient surgery, if it's done at an in-network ambulatory surgical center with an in-network surgeon, $50 point of occurrence deductible plus 45% after the $2,500 calendar year deductible. At the hospital, the difference is the point of occurrence deductible jumps to $250, and then you have the same 45% after the $2,500 deductible in a full hospital setting. Again, this is all in network. If you go out of network, it's different. See the benefit summary. Urgent care, go to any in-network urgent care you want. Does not need to be tied to a medical group, $55 copay. Emergency transport, you ride in an ambulance, it's going to be 45% coinsurance after the $2,500 deductible until you hit the $8,700 out-of-pocket max for in-network ambulance rides. Emergency room, $100 plus 45% after deductible. Now, please note, in a true life or limb-threatening emergency, it will all be treated as in-network, okay? So you're not going to be laying there unconscious in an ambulance worrying if the ambulance is in network or the emergency room you're taken to is in network. That will be treated as in network. So please don't worry about that. It's the voluntary choices like, hey, we want to give you an ambulance ride. Okay, I don't know if that's in network. If you walk into an emergency room in a not totally emergency situation, that could be problematic if it's out of network, okay? Prescription drugs, it's Anthem. So we have tier 1A, 15, tier 2B, tier 1B, 20, tier 2A at 70, tier 2B at 80, tier 3A at 110, and tier 3B at 120. Please note if you're filling a prescription, that's a tier 2 or tier 3 drug. There is a $200 brand deductible per calendar year that goes first before you pay your copay. Please note if you're currently on the Silver PPO, you're renewing, same rules apply as the Silver HMO. You don't need to worry about it if you've already met the brand deductible, the individual deductible, or out-of-pocket max. This plan is renewing, but it's going to roll on through until December 31st when everything resets on the calendar year. All right, let's talk about our dental program. So switching gears, we're going to go to teeth. Our dental program is offered through Humana. It is a PPO plan. The way this works is you get to choose your provider at time of service, and they're either contracted in network or out of network. Now, we do have the highest reimbursement available at a 90th percentile of usual, customary, and reasonable for out of network, but I'll explain a little bit how that works. The way this program works is if you get preventative care, it's covered at 100%. If you get basic services like endodontics and periodontics, that's covered at 80%. And if you get major services like dentures, that's going to be covered 50-50. There is a calendar year deductible of $50 that applies to basic and major services only. It is waived for preventative care and orthodontia. And please note, again, if you're currently on the Humana Dental, this is all part of this calendar year, even though we're having renewal on June 1st. So if you've already met your $50 deductible, that won't reset until January 1st. Unlike medical, dental doesn't have an unlimited max. They basically give you a bucket of money. We call that calendar annual max. In this case, on your plan, your calendar annual max is $2,000. That is per member enrolled, not per employee, so you don't have to pick your favorite kid, okay? The way it works is that as you get services done, money is taken out of your bucket. So for example, you go get a cleaning, the cleaning's $100. You have that covered at 100%, so you don't have to cost share. And $100 comes out of your $2,000 bucket, leaving you $1,900 for dental services. Same thing with basic and major. As you have services done, money comes out of your bucket, and that bucket is between both in and out of network providers. It is shared, okay? If you use up the entire $2,000 in the calendar year, that bucket is exhausted and it will not refresh again until January 1 of 2027. Now, please note, Humana, because they're awesome, does include an extended annual max. And what they say is, look, if you exhaust that calendar annual max, you're having the year, you know what I'm saying? 5 root canals, it's crazy. They'll continue to pay 30% of the rest of your covered services for the rest of the plan year. So let's say you end up spending the $2,000 and then you still need another $1,000 worth of dental done. They're going to pay $300 of that as a courtesy, through 30% of it, even though you've exhausted your calendar annual max. So it's like an extra benefit behind the scenes if you're having a really bad dental year, okay? We do include orthodontia for adults and children. That is a lifetime max. So same bucket of money concept, but once it's done, it's done. It does not refresh. There's no extended annual max, $2,000 and it's gone. So what happens is it's covered 50-50. So if you have $4,000 worth of orthodontia, Humana is going to come in with $2,000. You're going to come in with $2,000. Benefit is exhausted. It's done. Obviously, if it's above $4,000, the most you'll get is the $2,000. If it's under $4,000, the most you'll get is 50%. Please note, if you do choose to go out of network, you have a provider that you love, they don't take insurance. It happens. I get it. The way the program works is that the co-insurance is the same. The calendar annual max is the same, but non-network providers do not have to accept contracted rates, which is where we get into 90th percentile of UCR for the reimbursement schedule. So let's look at it this way. Remember I mentioned earlier, you went and got a cleaning at an in-network provider. It was $100. Now you're going to go get a cleaning at a non-network provider. And this provider believes that his cleaning is worth $200 because he's awesome and that's what he charges. He does not contract with Humana, so he does not have to accept their contracted rates. So he sends a bill for $200 to Humana. Humana looks at it and goes, all right, well, 9 out of 10 dentists in your area charge $150 for cleaning. So that's what 90th UCR is, what 9 out of 10 dentists charge usual, customary, and reasonably in that area. So Humana sends your provider $150. Now remember, that provider said, hey, I charge $2. So that provider can then balance bill you the $50 differential that was in excess of the reimbursement because they are out of network, okay? And network providers can't do that. Please note also, your bucket of $2,000 went down further because the contracted provider only charged $100 or had to accept $100. That out of network provider got $150, which means you have less calendar annual max available to you. These are the benefits for your Humana Dental PPO. The next program that we have is our vision program through Humana. And there are 3 tiers of benefits here. So please note, first off, benefits for vision are based on frequency, not calendar years. This is the oddball. This is different than medical and dental. So it's based on the last time you used it. On this program, you can get an eye exam, lenses, frames, and contact lenses every 12 months. So even though we're renewing on July 1st, if you went and got glasses last week, you're not eligible to get another eye exam or glasses till 1 year and 1 day after the last time you went and got it done, regardless of renewal dates or calendar year reset, okay? So keep that in mind. There are 3 types of providers you can select from: an in-network plus provider, an in-network provider, or you can go to anybody you want, but the reimbursement is very low. Please note the network that Humana uses is the iMed Vision network, and you can find a link on their website to look up iMed providers, okay? If you select an iMed provider that is in-network plus, it takes your eye exam to 0. So that's pretty awesome. If you go in-network, that eye exam is $10. If you go out of network, basically that provider is not going to bill Humana or iMed. Instead, what they're going to do is go, hey, that eye exam is $80. I'd like cash. Okay, here's a check or a credit card or whatever. They're going to give you a receipt. You're going to reach out to me and my team. We're going to get you a reimbursement form. You're going to fill that out, attach the receipt, mail it into Humana, and in 6 to 8 weeks, they're going to send you a check for $30 because the maximum reimbursement for an eye exam out of network is $30 regardless of what you've spent. So please keep that in mind. If you get lenses for your glasses, single vision is $25, whether you're in network plus or in network. Bifocal is $25, trifocal is $25, and so is lenticular. Okay, so you can get any of those 4 types of lenses for a $25 copay. Again, if you go out of network, the reimbursement is $25 for single, $40 for bifocal, $60 for trifocal, and $100 for lenticular, regardless of what you spent. And remember, that's up to. So if you only spend $90 on lenticular, you'll get $90. If you need frames, if you go to an in-network plus provider, you're going to get $200 towards your frames. If you go in network, it's up to $150. If you go out of network, you'll receive a reimbursement of up to $80. If you choose contact lenses, you can get up to $150 for elective, or they're covered 100% if they're deemed medically necessary. If you go out of network, you'll receive up to $128 reimbursement for your contact lenses. These are the benefits for our vision plan through Humana. It is a PPO, so you select your provider at time of service. Mora also offers a voluntary life and accidental death and dismemberment program through Humana. This allows you to buy additional life insurance at your own cost. You can purchase up to $100,000 for yourself and $35,000 for your spouse, as well as small amounts for your children. Please note, voluntary life does not have a true open enrollment. If you would like to make changes to your voluntary life, you would need to reach out to my broker service team at servicepro@tgfs.com or call us at 619-668-5202. You will not be able to make any changes on ease. Okay, so please reach out to us because there are very specific rules on when you can make changes because it does not have a true open enrollment. Please remember the cost of the insurance is based on age, and the price will increase for you and your spouse as you age into a new cost bracket. This benefit does include age reduction, which means also as you age at age 65, the benefit will reduce by 35%, and at age 70, it reduces again by an additional 15%, making the death benefit lower. So please be aware of that if you purchase the voluntary life or currently have it. If you need to look up provider networks, you can see here for Anthem, we've got anthem.com/CA. There's the member services phone number. Remember to use select network for HMO, prudent buyer network for PPO. We have links on the EASE website to take you directly to the website. Bing, bang, boom. Humana is going to be humana.com. There's the member services number. Humana's iMed Vision is also going to be at humana.com. And there's the customer service number. As I said, benefits work best when you see a preferred provider. And for our newest carrier, Sharp Health Plan, you're going to go to www.sharphealthplan and use the performance network for the HMO. So what do I need from you? Everyone must log on to EASE and complete enrollment to see prices and benefits. You will receive an email from the EASE system giving you access to log in and complete your benefit elections. Sometimes that email goes to spam or junk. That email will go out on the 23rd of April, so be on the lookout for it. If you do not see it by end of day on the 23rd, please reach out to my team or your human resources team and let us know so we can get you a login guide or get you a way to access the system. It is mandatory that every employee log in and complete open enrollment. We cannot conclude open enrollment until all eligible full-time employees log in and make elections. Even if you're making no changes, you don't take Mora's benefits, you're good to go. That's fantastic. Please log into the system and do that in the system so we don't have to call you a lot, okay? The deadline to complete online enrollment is going to be Monday, May 11th. So we're giving you a couple of weeks to get this done. If you have questions, please contact my service team again at 619-668-5202 or email them at servicepro@tgfs.com or reach out to your human resources team at Mora at humanresources@morallc.com. Thank you very much for joining me for this presentation, and I hope you have a great day.